Jenzi mukama wange. How are you? Yes, sir. You are with doctor, my neighbor, my uncle.
Thank you. Colleagues, I welcome you back. I wish this is what we had when we were debating electricity. It would have been very easy for me. Huh? Yes. As we wait for the ministers to be here for the matters of national importance, if the movers of the other items are here, I don't see the mover for item 4. I have to see them in the house. Don't see we can do the one of item 6. The mover is here. Yeah.
Item 6 on the order paper. Motion for resolution of Parliament urging government to revitalize Uganda's cotton and textile value chain through rehabilitation and operationalization of Lira spinning mill.
Honorable Minister Tuku. Honorable, you do around 10 minutes. Be a quick one.
Thank you very much, Right Honorable Speaker. Mr. Speaker, I moved under Rule 58 and Rule 69(1), Sub-Rule 1 of the Rules of Procedure of the Parliament of Uganda, the motion for a resolution of Parliament urging government to revitalize Uganda's cotton and textile value chain through rehabilitation and operationalization of Lira spinning mill. Mr. Speaker, this House resolves to urge government to rehabilitate, to recapitalize and operationalize Lira spinning mill as a strategic national industrial enterprise to promote value addition, revive Uganda's cotton and textile value chain, create employment and contribute to inclusive economic growth. Recalling that the Constitution of the Republic of Uganda 1995 mandates the state under the national objectives and directive principles of state policy to promote balanced, equitable development and economic justice, specifically Objective 12, Objective 11, Objective 14, cognizant that the 4th National Development Plan for the period 2025-2026 to 2029-2030 is anchored on the theme of sustainable industrialization, inclusive growth, employment and wealth creation, with overarching goal of achieving higher household incomes, full monetization of the economy and employment for sustainable socio-economic transformation. NDP4 identifies agro-industrialization and manufacturing as primary strategic pillars to drive import substitution, value addition, and youth employment. Aware that Uganda Bureau of State Statistics Multidimensional Poverty Index reports for 2026, based on findings from the 2024 National Population and Housing Census, revealed that 27% of Ugandans live in multidimensional poverty, characterized by severe deprivations in living standards, healthcare and financial services, concerned, Mr. Speaker, by the deep regional disparities highlighted in the 2026 UBOS report, noting that Lira spinning mills, once a thriving giant of the Lango sub-region, and indeed the entire region, was established as a strategic national asset designed to consume Ugandan-grown cotton, supplying domestic textile mills, provides stable employment, and anchored the regional economy before falling silent over 4 decades ago. Deeply concerned, Mr. Speaker, that the prolonged closure of Lira spinning mill has led to massive productive capacity loss, left thousands of youth, men and women unemployed, and deprived cotton farmers across northern and eastern Uganda of a stable domestic high-value market, leaving Lango sub-region reliant on subsistence farming, selling raw cotton exports with little to no value addition. And fully aware, Mr. Speaker, that according to the Uganda Bureau of Statistics, over 78% of the working population in the sub-region is locked in subsistence agriculture, with over 44% of the youth falling under the not in employment, not in education or training category, and up to 80% of young women engaged in unpaid family labor, which renders the revitalization of Lira spinning mill a vital economic necessity to absorb an estimated 70,000 unemployed or underutilized youth and women in Lira City and neighboring districts. Appreciating, Mr. Speaker, that the revitalization of the spinning mill directly promotes Buy Uganda, Build Uganda, national self-reliant framework by providing the domestic production capacity required to operationalize the second-hand clothes import restrictions under the newly enacted External Trade Amendment Act 2026, which imposes a 30% environmental levy on imported second-hand clothing and worn articles. Now, therefore, Mr. Speaker, honorable members, be it resolved that Parliament urges government to undertake legal and commercial to establish its current requirements and the most viable public, private, or state-led business model. Mobilize the required finance cooperation, the UDC, public-private partnerships in strict compliance with public finance laws, and according to the Uganda Investment Authority, a fully integrated modern cotton spinning mill project in Lira would require an estimated investment of roughly $58 million, a figure highly viable under a structured government recapitalization or a public-private partnership model. 3, revise the cotton production across the Lango sub-region and neighboring cotton growing zones by providing farmers with high-quality seeds, modern cotton farming extension services, cooperative organization support, and subsidized inputs to guarantee a steady cotton raw material supply chain for the mill. And enforce Buy Uganda, Build Uganda policy directives by making sure that government ministries, departments, and agencies like the military, police, prisons, and public schools source their uniforms and textile domestically from Lira Spinning Mill and local partners once they are fully operational, and that once rehabilitated, Lira Spinning Mill should give priority to the youth and women in job creation, training, and micro-enterprise opportunities arising from the revised spinning, weaving, and distribution networks. Mr. Speaker, that the government reports back to Parliament within 6 months from the adoption of this resolution with a comprehensive roadmap, financing structure, and realistic timelines for the physical rehabilitation of the spinning mill. And finally, Mr. Speaker, honorable members, that Parliamentary Committee on Tourism, Trade and Industry immediately takes a keen interest in and actively support this undertaking to inform the revival of the spinning mill and the wider cotton sector, given their significant potential to promote agro-industrialization, create employment, and enhance value addition and stimulate economic growth in the country. I beg to move.
Thank you, Honorable. The motion seconded. Honorable Obiga Rose, Honorable Masaba, I'm saying DP Whip, I'm saying Arua Central, Honorable JB Mususi, Dr. Rudeo, Honorable Fonopondo, Dr. Makid, and most of the colleagues in the House, including the Minister for Cooperatives. Yeah. So, Honorable, this is self-explanatory. But, okay, you can go through this justification if you're going to go through it the way it is. Yeah.
Right, Honorable Speaker, honorable members, the spinning mill was once celebrated as one of the largest spinning facilities in East Africa and actually the East and Central Africa. Unfortunately, the mill has sat dormant for decades, representing a massive underutilization and misuse of a national asset that can substitute for imports in African countries currently importing cotton yarns, such as Egypt, Morocco, Tunisia, Nigeria, Tanzania, and Ethiopia. Honorable Speaker, for over 40 years, this country has exported raw ginned cotton for peanuts, only to import back finished textiles and second-hand clothes at a premium. And this is economic sabotage, Mr. Speaker. Lira Spinning Mill represents an opportunity that can restore a strategic link between agriculture and manufacturing that can advance Uganda's industrialization agenda. Honorable Speaker, in March this year, UBOS, Multidimensional Poverty Index report revealed the bitter truth that 27% of our citizens are trapped in multidimensional poverty, as already suggested earlier. The primary driver of the poverty in Lira sub-region and indeed in the greater region is the lack of a stable, value-adding jobs and reliable markets for cash crops, Mr. Speaker. And cotton is a crop grown by the poorest households in this area. And reviving the Lira spinning mill shall therefore reduce the risk of cotton farming by guaranteeing a stable domestic buyer in the name of Lira spinning mill. It shall create thousands of direct jobs for factory workers, for engineers and administrators, given we have thousands of youth unemployed at the moment in the region, but also nationally. It will generate tens of thousands, Right Honourable Speaker, of indirect jobs for cotton pickers, logistics providers, and micro-tailors along the value chain. Honourable Speaker, members, this motion takes a highly responsive, business-minded approach, and we want a thorough, objective assessment to determine the best modern operating model, whether state-owned, whether joint venture, or private public partnership, to ensure we build an enterprise that is financially stable, globally competitive, and built to last. I pray that this House, Right Honourable Speaker, honourable members, adopt this resolution in the spirit of national interest, economic justice, and sustainable industrialization. I beg to submit. Thank you.
Thank you. Honourable Bigarose.
Thank you, Right Honourable Speaker. Right Honourable Speaker, I rise to support the motion to rehabilitate, revitalize, and capitalize Lira spinning mill. Right Honourable Speaker, if you see most of the garments that are made out of cotton, it's easy to decompose them. That will not be a threat to environmental degradation. Two, Right Honourable Speaker, Lira spinning mill has been employing a lot of youth. We are here fighting with our youth unemployment. Right Honourable Speaker, if in the previous years we used to have cotton in also in Rhino Camp. A lot of cotton up to this time is grown in Openjinji, Ragame, Rhino Camp, and so forth. We would really be grateful, even not only the Lira spinning mill, if the one in Rhino Camp is also revitalized, capitalized. Right Honourable Speaker, I remember AGOA girls sometime got a challenge of having no raw material, yet their basic raw material is cotton. I went to buy the yellow t-shirts for my campaigns from AGOA girls. We had shortage because there is no capitalization, there's no revitalization. I'll really be grateful if Lira spinning mill is revitalized, is capitalized. Thank you. God bless you.
Thank you. Honourable Edakas. A procedure, Honourable Cohen.
Thank you, Honourable Speaker. I want to move under Rule 60 of our Rules of Procedure. My name is Amanya Cohen, Member of Parliament, Higara West Constituency. Honourable Speaker, the motion talks about only Lira spinning. We have so many other sectors, especially in cotton. In Bunyargur there is one, in Pakwach there is, in Kasese there is. So instead of us only looking at Lira, we amend the motion and include the areas, those areas of cotton within Uganda. Thank you very much, Honourable Speaker.
Before I just put the question, I just wanted to know from the mover, would that be okay? Yeah. The mover?
Right Honourable Speaker, I would be glad to have it amended. Thank you.
Is the motion seconded? Good, I can see seconded by majority. Yes. Yeah, of the House. So the question will encompass, will encompass all cotton milling factories or whatever we call them, okay? At the end of the day. Yes, Honourable Edakas is here. Honourable Ariera Omodi. Honorable James Kakoza. Okay. These were the seconders. So I wanted just colleagues. I can see really general, general consensus on the matter. Okay, just. Yes, I will at the end of the day I ask the minister to say something. Honorable Azar is here. Yes, let me allow one from Lango, Honorable Achon, and one from Kasese. I know there is a meeting in Kasese.
Speaker, I also rise to support the motion by my colleague Zoyam. Honorable Speaker, the time I was born, I remember cotton was one of the basic cash crop in Lango. If you are not grown, you would be considered as a poor person. And by then there was plenty of water, rain, of course. We had rainfall that time, so there was plenty of water. So, Right Honorable Speaker, it looks so bad from in 90s. Then the spinning mill collapsed. Cotton was not considered in the region. Then with the war which came in northern Uganda, it kind of deteriorated a lot in the region. And that's caused a lot of issue in Lango. When you look at the population of Lango, we are 2.5 million. But we do not have any tangible factory or any cash crop that we are growing. Now we rely only on the food crop, which on a daily basis. So I therefore appeal to this government really to come up to resume back the factor of spinning mill so that people of Lango, of northern Uganda and other region really to come up and support the cotton growing. And when you look at the number of expenses of the clothes which we are facing just because we lack cotton. Like for politics, if we want to order t-shirts, you know, we have to go like to China, to other places, which we just have it here. And the population also, we lack a lot of employment because look at the youth in the northern after the war, we should be having something on daily basis in Lango to have our people survive. Thank you.
Thank you. Yes, Dr. Rude. And then the minister.
Yes, thank you so much, Right Honorable Speaker, for this opportunity. For the record, I'm Dr. Rude from Bukonzo County East. Right Honorable Speaker, from Bukonzo County East and actually Kasese at large, we have grown up with two types of cash crops being grown, and that is coffee and cotton. And remember, we are among the leading producers of both of these two items. Therefore, this discussion is very right, and I do associate myself to the motion in support of revitalization of all the value addition processes for our cotton. And specifically in Kasese, actually with the processes of value addition actually not being focused on, even prices have gone very low. The farmers are suffering, they are investing in a lot, but harvesting peanuts. So ultimately, the prices are very, very low. So with government coming on board to revitalize these milling machines, eventually we are going to have market for our cotton readily available at the milling places. Number two, we are going to reduce on the importation of textiles from outside and utilize our own cotton here and produce clothing. The other time we were in general elections, and you know that yellow t-shirt was on a huge demand, and we were being told that there is no more material to produce them. How I wish that we had textile, cotton, value addition, plants all over. These materials would have been all over and would have gotten in plenty. I associate myself together with the people from Bukonzo County East with the motion. Thank you.
Thank you. That's Honorable Diarra? No. The honorable gentleman next to Dr. Musa. What? I saw he looked passionate about this issue.
Thank you, Right Honorable Speaker. For the record, I am called Richard Ongorok, from representing the people of Wusu County. I rise to support the motion on the floor. You are aware, Mr. Speaker, that Teso is renowned for cotton growing. That was way back, before the collapse. The 1969 National Population Census put Teso as one of the big economies in the country, and Teso was ranked high, equivalent to the areas of Buganda, that is Wakiso, Mukono, in terms of income. And that income was arising from cotton and cattle. Our economy collapsed starting from the 1970s. Up to date, Teso does not have any cash crop. And therefore, I rise to say that let government revitalize the cotton industry, because it was through cotton that our children were able to go to school. It was through cotton that the government was able to get forex, because at that time, 1960s, cotton was the third most important forex earner in the country. And therefore, I believe that revitalizing this industry will enable a majority of communities in Uganda that have no cash crops right now. The benefits of cotton not just cover textiles. You know this, from seed, we can get animal or cattle cake. From seed, we can get cooking oil. And therefore, cotton has got a lot of value. I submit, Mr. Speaker.
Thank you, Honourable Minister. Just 2 minutes on this, Honourable Minister.
Thank you very much, Right Honourable Speaker. And I'd like to thank the movers of the motion about the revival of Uganda's cotton and textile value chain through rehabilitation of Lira spinning mill. But, Right Honourable Speaker, since the motion has been amended, maybe you allow me to come with a comprehensive report so that we capture the whole country where cotton is being grown. However, allow me to specifically go to what Honorable has just raised here, briefly in 2 minutes. Allow me first go historical.
No, on Ewaza.
Yes.
I kindly give you 2 minutes, okay?
Yes.
I just need your commitment on this.
Okay.
Then under Rule 229 of our Rules of Procedure, you're supposed to bring an action taken report. Because the motion has gone deeper. Now, if you go historical, we shall sleep here. I know you very well.
Most obliged, Right Honourable. Let me now, first of all, thank the mover of the motion. We will come and give a comprehensive statement or report about the same, covering the whole country. Yeah, so that we get to know what's happening in the issues related to cotton growing, then find solutions of reviving, revitalizing Lira ginnery and other ginneries that are spread all over the country, including West Nile, Central.
Thank you. Honourable colleagues, I now put the question that the motion for a resolution of Parliament urging government to revitalize Uganda's cotton and textile value chain through rehabilitation and operationalization of Lira spinning mill be adopted with amendments. Those in favour sign, to the contrary, nay. Aye. The ayes have it. So, Honourable Clerk, extract a resolution, pass it on to the relevant minister, and as per Rule 229 of our Rules of Procedure, an action taken report will be brought here. But In the motion, they requested for 6 months. Yes, and our rules provide for 60 days. So let's go for 6 months so that the minister is given enough time. Because it has a budgetary implication, I don't want the minister to just come and say, I presented it to cabinet and, 6 months we shall be monitoring whether even in the budget they've taken some steps, and if they are baby steps and all that. Thank you. I have matters of national importance, but let me also first deal with item 4. Then I'll be getting, Honorable Eunice, congratulations. And congratulations, well done. So, thank you. Yes.
Item 4 on the other paper, motion for a resolution of Parliament urging government to improve access to geriatric health care and enhance social protection for older persons.
Yes, Honorable Mafabi, 10 minutes.
Mr. Speaker, sir, I rise on the motion for a resolution of Parliament urging government to improve access to geriatric health care and enhance social protection for older persons, moved under Rule 56 of the Rules of Procedure of Parliament. Whereas Objective 20 of the National Objectives and Directive Principles of State Policy enshrined in the Constitution of the Republic of Uganda, 1995, directs the state to take all practical measures to ensure the provision of basic medical services to the population. And whereas Uganda ratified the International Covenant on Economic, Social and Cultural Rights, 1966, which requires state parties to recognize the right of everyone to the enjoyment of the highest attainable standard of physical and mental health, among others. Aware that the government has demonstrated its commitment to the protection and well-being of older persons through policy frameworks, including the National Policy for Older Persons, which provides the equal treatment, social inclusion, and livelihood support of older persons, and the National Social Protection Policy, which recognizes the particular vulnerabilities of older persons and guides the delivery of targeted social protection interventions in Uganda. Further aware that government implements social protection and economic empowerment programs for older persons, including the Senior Citizens Grant under the Social Assistance Grants for Empowerment Program, which provides a monthly grant of 25,000 shillings to every eligible older persons, considering that Uganda's population of older persons, estimated at more than 1.4 million persons aged 60 years and above, continues to grow and bears a disproportionate burden of non-communicable and age-related conditions, including hypertension, diabetes, arthritis, cancer, and dementia, which require continuous and often costly medical care. Noting that although the Senior Citizens Grant provides important financial support to older persons, the monthly grant of 25,000 shillings is insufficient to meet their basic and healthcare needs, and program reaches only a proportion of eligible older persons because of its coverage and age requirements. Concerned that the majority of older persons reside in rural areas, have no health care insurance, and have limited access to specialized geriatric care, essential medication and diagnostic services, assistive devices, and affordable transport to health facilities, thereby exposing them to preventable illnesses and deterioration in their health and equality of life. Further concerned that public health facilities across the country generally lack dedicated geriatric units, health workers trained in geriatric care, and age-friendly infrastructure and services, including ramps, rest areas, and priority service points. Recognizing that accessible and affordable healthcare services tailored to the needs of older persons, complemented by preventative health interventions across the population, would promote healthy aging and reduce the long-term burden of age-related illnesses on families, communities, and the national healthcare system. Now, therefore, be it resolved that the Parliament urges government to, number one, introduce a health insurance scheme specially targeting older persons to facilitate free or affordable access to essential medicines, diagnostic services, and treatment for age-related and chronic conditions. Number two, strengthen community and home-based care programs for older persons, including mobile health clinics, community outreach services, and older person support committees, particularly in rural and hard-to-reach areas. Number three, establish dedicated geriatric units and age-friendly service points, including priority queues, ramps, and rest areas in all regional referral hospitals and progressively in general hospitals and health centers. Number four, train and deploy health workers in geriatric medicine and elderly care. Number five, introduce quarterly health checkups for older persons at designated health centers to promote health screenings, preventative health care, and align the dates of the checkups with the payments of the senior citizens grant where practicable to improve access to both health and social protection services. And six, review and expand the social assistance grants for empowerment programs in relation to its coverage, eligibility age, and the amount payable to beneficiaries to ensure that the program meaningfully contributes to meeting the health and other essential needs of older persons. I beg to move.
Thank you, Honorable Aisha. For record clerk, I allowed the motion under Rule 58 of our Rules of Procedure, not Rule 56, because Rule 56 is for matters of urgent importance. So Rule 58 is the one which has to do with the motion. So I need that captured. Is the motion seconded? Seconded by the Minister for the Elderly, Honorable Jackie Mbabazi. Seconded by Erida Tomaza. Seconded by Honorable Mavenjina Elderly. Seconded by Honorable Anyakun. Honorable Court by General Gonyi. Is he Jaramel? Jarameso? Yes, Jarameso Ajuri. Honorable Katabazi, Chichoncho, Ati Nakaseke, is it Nakaseke? Nakasongora. Yes. Seconded by the new Minister of State for Internal Affairs. Who is here? Yes, Honorable Biara, Shadow Minister for Gender, Honorable Anthony. I can see Honorable Richard, Honorable colleagues, Honorable Beta Angora, Honorable Bisats, Honorable Carissa, Honorable Noerin, Honorable Court. Colleagues, by majority of you, Honorable colleagues, isn't it? Yeah. Even Marshall, Marenyo. Okay. So, Honorable, you can use, you feel this is enough justification? Because I can see you have put your case properly. Do you want to speak more on this? I allow the seconders and some debate. You feel this is sufficient?
I think it's sufficient, but I had a justification. But I can see it if it's sufficient for the House.
Yeah, I think this is sufficient.
Sufficient, eh?
Yeah, yes.
All right.
Can see,
Thank you so much.
Yeah, so that will save some minutes for debate, okay? So I can see on the seconders, I see Honorable Court Boniface. And let me start with the Court Boniface, then Honorable Baseke Fred. Then I'll do Honorable Mavinjina.
Thank you, Right Honorable Speaker. When you look at the support towards this motion, you'll notice that there's a general acknowledgement that we are all candidates for old age. And one Right Honorable Speaker, on the 20th of November last year, during the busy election period, the then Minister for State for Elderly Affairs made a big pronouncement at the Uganda Media Center. In his pronouncement, he indicated 3 core areas that the cabinet had resolved on, and one of them was on eligibility in terms of age for the SAGE program, and indicated that it had been lowered from 80 years to 65 years. The second pronouncement was that the monthly grant for SAGE had been increased from 25,000 to 35,000. And thirdly, indicated that these changes would take effect in this ongoing financial year, 2026-2027. I think the most important question all our older persons are waiting for this evening, the 1 million who are above 65 years of age, is when the implementation of these changes will begin. And I'm hopeful that the minister will clearly pronounce the minister will pronounce herself on these matters. Right Honorable Speaker, you'll also notice that this House has consistently debated the issue of SAGE, particularly when it comes to access to that grant, and that these older people have to travel long distances many times to access this money. And it would be of good consideration to these particular older people that government considers accessible platforms like mobile money, for example, so that the older people do not travel these long distances, because at one point, an 84-year-old woman in 2004 lost her life in Pakwach district in trying to access this particular support. Right Honorable Speaker, you'll also notice that support for older persons is about 120 billion shillings under SAGE. But 30 billion of that money is for administration. And this is a very huge fraction of the money that is available. And if we could save on these administrative costs so that there is further increment in the grants that these older people get. Finally, on geriatrics, Right Honorable Speaker, the specialists for geriatrics are not very many. And if you notice in all our institutions of higher learning, there is no institution of higher learning providing this course at a master's level. And it would be important for our institutions to consider investing in more of our human resource in this particular sector. Thank you. I beg to submit.
Thank you. 2 minutes each. Honorable Baseke Fred. Then Honorable Mavinjina.
Thank you, Right Honorable Speaker. I want to first of all thank the move of this motion, Honorable Asha Mafabi Nabulo, for your foresight and commitment to the plight of older persons. Right Honorable Speaker, older persons form the foundation of our community. Therefore, as members of Parliament, it is our moral and constitutional obligation to support their plight. Research shows that 45% of older persons live below the International Extreme Poverty Index, and only 2.3% are able to receive a pension. The rest depend on family support and some form of senior citizen grant. Similarly, many older persons above 60 years in our communities are still living with chronic illnesses, as mentioned, like diabetes, arthritis, dementia, and cancer. Yet our health systems, like they have mentioned before, we lack professionals in geriatric services, and we have insufficient age-friendly services. In districts like Kayunga, where I come from, most of the older persons do not have any form of health insurance. They struggle to access diagnostic services, assistive devices, and affordable transport facilities. When you look at the social protection front, we appreciate government for having the senior citizens grant and a SAGE. But while this program is appreciated, we still have older persons who are not getting this money. Many older persons still are in poverty and ask. Just let me. Right Honorable Speaker, investing in older persons is not a burden on government. It is an investment in dignity, welfare, and social stability. I therefore want to support this motion and urge honorable colleagues to support this motion as a statement that Parliament stands with the older persons. I beg to second.
Thank you. Honorable Mavinjina. Then we have our former coordinator for the Forum on Social Protection. Now he's a member of Parliament, Honorable Choncho Katabazi.
Thank you very much, Right Honorable Speaker. I would like to thank my colleagues, the woman MP for Sirongo District, Honorable Nabulo, for moving this very important motion about the older persons. Right Honorable Speaker and colleagues, old age is a special gift from God. And by the time you reach 80 years, you must be a special person who serves God throughout your life. And so right now we have very many of our older persons who are suffering out there. And I want to thank government very, very much, especially President Museveni, who allowed we, the older persons, to be represented in this parliament. And we are not many, we are only 5. But I know there are also many of our colleagues here who have come to parliament in their own rights, and they are also old. So we thank God for all the old and young. And so, Right Honorable Speaker and honorable colleagues, the geriatricians we are talking about, I think in the whole country there are only 5. And for me personally, I don't even know how to access them. And if I cannot access them, what about our older persons who are in the countryside? Right Honorable Speaker and colleagues, for us when we came to Parliament, it was also a tug of war to get insurance scheme for us, because they were saying we are too old. But I want to thank Parliament and the government for the intervention which made us get a health insurance scheme. I would also like to...
Switch on, Honorable.
I would like to appeal to our government and honorable colleagues and all of us to consider our old persons to have insurance scheme while we are waiting for the 35,000 shillings for SAGE to take effect. It is true we all heard about it. I personally didn't want to tune the older persons in my constituency until when it came out in black and white. And so we are all eagerly waiting at least for the 35,000 increase for our older persons. Right Honorable Speaker and colleagues, 35,000 is also not much, but at least it is something for which we must thank the government and must be grateful. So I would like to appeal to government to try all possible ways of finding these 35,000 shillings per every older persons. I know the parliament had already okayed it because many of our people here love us older persons and they respect us very, very highly. So colleagues, I would like to appeal to you that we should continue to advocate and support our older parents, our grandparents, and all of you, because you are all heading to our age. Thank you very much, Right Honorable Speaker.
Thank you, Honorable Choncho. Then the Minister.
Thank you, Right Honorable Speaker. I'm Choncho Katawazi Patrick, Member of Parliament for Ruchiga, and as rightly pointed out, former coordinator for the Uganda Parliamentary Forum on Social Protection, a forum that has been very active since 2012 on this matter of providing and extending social protection to older persons in this country. I rise to support the motion, and I would like to augment on the aspect of financing for social protection, particularly on the program called SAGE. You have been told that the budget currently it is at 121 billion, which is currently supporting about 316,000 older persons. Now, this resolution or decision by cabinet of lowering the age 65 would mean that about 1 million older persons would be supported at a rate of 35,000, which then would require an additional 252 billion to be able to come to 373 billion to cover all older persons who are above 65 years of age. I know that sometimes resources are not enough, and I would like to propose to government to look at it possibly in a phased manner if indeed resources cannot be availed, because this was supposed to take effect this financial year, and in this budget is not there, but it's not too late, because this is a very, very important area in which government can even explore having a supplementary budget. And in a phased manner that I'm proposing, let us reduce progressively to 75 years, and that would take us to 500,000 older persons, which then would need a budget of 192 billion, which then would be an additional of 71 billion. If the subsequent year will go to 70, we would cover 764 older persons, which would be an addition of 157 billion, and at 65, like I said, in the third year would be very sufficient to cover older persons. This program was saved by this parliament in 2018 by a parliament resolution for a national rollout. It is this parliament still that I think can be able to save the older persons of this country because of the prominent role that they continue to play as custodians of wisdom, but also as people that we must recognize for the important role they have contributed in this country. I beg to support the motion.
Thank you, Honourable Minister.
Thank you, Right Honourable Speaker. Right Honourable Speaker and members of the House. I want to take this opportunity to thank the Honourable Naburo for bringing this motion to Parliament. Thank you, my daughter. And I want to thank all those who seconded this motion, and also the Honourable Chichonjo, who is the coordinator of social protection. Today I turn 72, Right Honourable Speaker. I'm happy to be an older person, and I'm happy to represent the older persons of Western Uganda in Parliament, but also as Minister of Older Persons of the whole country. Right Honorable Speaker, it is true, as the members who spoke before said, that the older persons are the ones who have laid the foundation for this country. We are the ones who have brought Uganda to where it is today. And for that matter, we need a lot of respect, we need a lot of care, we need our dignity. Now, those who spoke about the motion and the move of the motion dwelt on geriatric care. Geriatric care is the medical care for older persons. Right Honorable Speaker, we have only three geriatric and we do not have any geriatric nurses at all. In fact, Uganda does not train any geriatric healthcare personnel. We have just recruited one of the geriatric doctors on the National Council of Older Persons, and we're happy to have her, and she's going to help us a lot. So, Right Honorable Speaker, as a ministry, we are engaging the Ministry of Health so that we discuss this area of geriatric care. We are engaging very soon Makerere University so that the curriculum for geriatric doctors and geriatric nurses is adopted in the education system of the medical workers. We are also about to engage Ministry of Health so that whenever we are distributing SAGE, it is distributed at health center 3s, so that at the same time, these old people get some medical care, and we arrange as a ministry to put some medical camp for those people to be cared for. On the question of SAGE, 25,000 is very little money, but Right Honorable Speaker and Honorable Members, we have found out that these 25,000 shillings, 30% of it is used for medical care. And therefore, the issue of medical insurance is extremely important. And as a ministry, that's what we are looking at. We have already met a few insurance companies and discussed the medical. And probably when we increase to the 5,000 per month or so could be used for medical insurance. It's extremely important. As far as the conveyance of SAGE money is concerned, we have a lot of difficulties. This SAGE is being given out at sub-counties. And of course, many of our old people cannot go to sub-counties. I saw one of them being wheeled on a wheelbarrow to a sub-county to receive SAGE money. So in the ministry, we are looking at options, better options of this SAGE money reaching the people. But I must remind dear members that our old people forget their PIN numbers. We could put the money on the phones, but they are going to forget their PIN numbers. And most of their phones are being held by their children and grandchildren who are actually taking away this money from them. So it's a very, very big problem, but nevertheless, we are looking into it. Now, regarding the increment to 35,000, indeed, it was a decision here, and it was a cabinet decision, and it was communicated to the people. I think most of you even used it as a campaign tool to get those votes of the older persons. Unfortunately, Right Honorable Speaker, this was not put in the budget of this year. And I wish to request that together find ways and means of, as the Honorable Choncho said, is 200 billion. Right, Honorable Speaker? Dinners for their families. The people above 60 are looking after families with a population of 7.2 million people. And they are the only ones looking after these people. And therefore, it is important to get that 35,000. Regarding the other programs, we have SEGOP, where they are supposed to borrow, to get some 5 million shillings per a group of 5 people, and they've been getting it. It started as 5 billion. We are pushing that it comes to 10 billion. Hopefully this year it should be raised to 10 billion so that as many people, as many old people as possible get it. Those who cannot get parish development model money, even if we encourage them to get the 10% of the PDM. So as a ministry, we need your support, Right Honorable Speaker. We need support of the Parliament. We are every day working on this since we started, and we are sure together with yourselves we shall succeed. I thank you very much.
Thank you, Honorable Minister. Honorable Jane Ruth Acheng, you wanted to add on something from a medical perspective?
Right Honorable Speaker, allow me to thank the mover of the motion and also to thank the Minister for her very passionate presentation. Right Honorable, I only want to add a few things to bring to the attention of the members that the National Development Plan 4 captures issues of the elderly and geriatric services in details. Why do I say this? Because I personally participated in putting them there. Number 2, it captures issues of training for the geriatric doctors and the nurses. Also in details. All we need are resources so that that can be implemented. In the meantime, the Ministry of Health entered into a public-private partnership with an organization, and there is ongoing training of geriatric nurses. In fact, if any of you needs one here, you can just contact them and they will give you one. But that will be at your cost. But what we want is that they are supported because the elderly need them. It is very true that we have only 3 geriatric doctors, and they are only based in Mulago. But the elderly are so many, 1.4 million all over the country, and we need them in every part of the country. It is important that we invest in this area if we are to have a good output from what we deserve. Lastly, Right Honorable Speaker, on the issue of the health insurance, I just want to guide the Minister that if we are to have an insurance targeted only to the elderly, as a country we are likely to fail. We need an insurance scheme that covers all of us, including the children, because the principle is solidarity. The rich supports the poor, and our elderly are only receiving 25, now 35 if it happens. They are not able to contribute. So let's push for what we had already started, which has been pending, which has already been well worked on, so that that law is approved and all of us have an insurance scheme, so that we don't put a heavy burden on the elderly or expect the government to pay only specifically for the elderly. I thank you.
Thank you. Colleagues, I now put the question, the motion for a resolution of Parliament urging government to improve access to geriatric health care and enhance social protection for older persons be adopted. Those in favor say aye, and the contrary nay. The ayes have it. Now, Honourable Minister, I can see you supported the motion strongly. Now the ball is in your court. Rule 229 of our rules of procedure says you report back in 60 days. And you tell us the progress you've made in implementing this resolution as a government. Otherwise, count on us as a parliament that on issues of the elderly, we always support. Thank you. Now, colleagues, I have matters of national importance, which I want to be handled now. And I'll start with Honorable Karim Masaba, and then after I go, Dr. Wakida. 2 minutes.
Thank you very much, Right Honorable Speaker, and I do rise on a matter of national importance concerning the alarming state of Mbale Central Market and the
Honorable Minister, this is your issue. So, this is your issue. So, yes, as long as you are listening in. Please go ahead, Honorable.
Yes, Right Honorable, I rise on a matter of national importance concerning the alarming state of Mbale Central Market and the continuous injustice being inflicted on more than 5,000 traders who depend on the market for their daily survival. Right Honorable Speaker, what has happened, I had a meeting with the town clerk and the division mayor, and they did show me a letter signed by the former minister of local government showing a stiff increment in rent dues that they're supposed to pay in the central market. And as per the letter, you will find that a stall of 5,000, they will be paying 20,000. One who has been paying 30,000 will be required to pay 300,000. One who has been paying 100,000 will be paying 500,000 shillings, which the traders believe are quite huge and unreasonable, and there was no due process, no consultation or engagement with them was involved. Right Honorable, as I speak, the market master was suspended. The leaders of the different sections in the market were arrested. Some of them, I did help them get bail, and they're out as I speak. The market has not been having water for a while. The toilets, of course, now they cannot use them. The roofs of the market are leaking. When you look at the garbage around the central market, they were given a truck by City Council, but unfortunately, they have to pay for the driver of the City Council. They have to fuel the truck to ferry garbage from around the market. Then there are issues to do with landlords, people who got stalls and shops in the market who are charging people exorbitant fees. So Right Honorable and Honorable members, my prayers are four and brief. One, my prayers is that government through the Ministry of Local Government takes the following steps: convenes an urgent meeting with the local authorities and stakeholders of the market and agree on a reasonable rent fee to be paid by the traders. Two, restore reliable piped water in the market toilets and undertake to do the repairs that include the roofs that are leaking and other non-functional facilities. Three, complete a transparent time-bound verification and reallocation exercise that prioritizes active, genuine vendors and permanently ends the practice of exploitive subletting by self-proclaimed landlords. And lastly, ring-fence a clear and publicly reported percentage of the market revenue for sanitization, garbage collection, water, electricity, and structural maintenance. Right Honorable Speaker and members, I beg to submit. Thank you.
Honorable Minister.
Thank you very much, Right Honorable. I remember in January, towards the election, I visited that market. I addressed some of those concerns. Now they have re-emerged. I remember that time I worked closely with the Honorable Rafael Majezi. Now these are things that can be resolved very fast. In Imbarara, they had similar problems. I had a meeting with them, my last visit in Imbarara. They sorted it. They had a chairman who had become a landlord. That chairman was removed. So we told the marketing master is the in charge, but then there are departmental leaders too per departments. So we shall do the same application. Only the contractors who built those markets, all of them need to be jailed. They put low gauge iron sheets, very low gauge iron sheets. The markets, we have had the same problem. Now this, I will need to ask the contractors who are given all these markets to fix that, or else we blacklist them from doing any kind of business. Two, the issue of landlords in a market. The president made it clear. Politicians, actually, what Honorable Karim did inform you that there are politicians with stalls, which is wrong. So I will involve the commissioner of markets, local government, shall hold a meeting to submit a list of the people who are eligible to get. Whichever politician has, that will be potea. We give it to the poor who don't have stalls. Markets were designed for the poor people, not for the rich. So, Right Honorable Speaker and Honorable colleagues, wherever you are, we shall remove the rich.
Thank you, Right Honorable Speaker. I would like to appreciate the Minister for Local Government, Honorable Balam, concerning markets in this country. Right Honorable Speaker, government injected huge amount of money for putting up markets across the country. And if you look at other markets, for example, Gulu, the design alone, the moment you entered in that market, is like you are going inside the oven. The roof is too low. In fact, the quality does not correspond to the amount of money which was injected. I thank Honorable Minister for your activities across the local government. What you are doing is going to eradicate corruption in the local government. And I pray that you continue with that activity. Move across the country, investigate all those ones who are given contract for the markets. Those ones who are not serious, you arrest them as you normally do. Thank you.
Right Honorable Speaker and Honorable colleagues, whoever is involved in a shoddy deal, whether it is 3 years, 7 years, 10 years ago, it remains shoddy. They will pay back, they must vomit, and they must face the law. As simple as that. So the problem in Mbale market is the same problem in Kabale. In Kabale city, there are people who have been crying. The original occupants were denied. Then those who had the money, the Ruth Achengs, were able to, not this Ruth Acheng of Kabale. There's a lady called Ruth Acheng of Kabale. They were able to get stalls. So there's a lady called Ruth Acheng of Kabale. So we are going to sort it. Ambarara was sorted. Mubende, I met Honorable Sumaya of UNOP. She took me there. We resolved it. And even we actually gave the poor who had not gotten, the original occupants were given 4 stalls. We got stalls. I asked them where did the stalls come from, but they were able to find the stalls of those people, which had been taken over because they were voiceless. So Honorable Karim informed the traders, for now let them pay the previous amount till when I come there, probably next week or the other week. I'll come there and we have it resolved. Thank you very much. Submit.
Thank you. Now, Honorable, I would propose that you formally, you as a minister or as a ministry, you inform them, not Honorable Karim Masaba. Okay? Because it's you with the executive authority. He has raised the matter. If you could inform them today evening, so that they are not paying that huge amount as you come to resolve the matter.
I'm also obliged, Right Honorable. Let me have a letter given to him in the next 10 minutes.
Thank you. But don't go away, still need I have some few issues. Colleagues, as you can see, we have to adopt other ways of working. And it seems to be effective. It's working. So we have to adopt. Dr. Wakida?
Thank you, Mr. Speaker. Honorable colleagues, I will use Rule 55 of procedure of this Parliament on a matter that is urgent of a national nature regarding the manner in which the State Minister of Local Government has been conducting her businesses in a fight against corruption in the eastern part of Uganda. Mr. Speaker, the government policy to fight corruption is supported by all of us here. Corruption bleeds our health centers, it bleeds the schools, and every aspect of this society. However, Mr. Speaker, the method being used in this fight collapses the very essence of governance. Over the last few days, the State Minister, and I will repeat, the State Minister for Local Government was in Budaka District. In the case of that period, a number of outrageous things happened. I saw for the first time a medical doctor being publicly harassed and arrested in front of the people they have been treating at the facility.
Maybe, Dr. Wakida, what I didn't tell you, when your time is up, you ask for more time.
Can you please give me more time?
You did.
I request for more time.
No, just I want you to get this first.
Yes.
Okay? Just take your seat for a minute first. Because you did it when you were in electricity. Yes. You continued, and I saw the discomfort of members because they know how strict I am. Now I saw you repeating it, and you're clever, you don't give me your face. So let it be just the last time it happens. Yeah. He has not been here, he has been...
Thank you, Mr. Speaker.
He has been indisposed.
I saw the health workers being arrested. I saw the parish chief and LC1 chairpersons being summarily ordered to be sacked. At one point, the parish chief was told he's not supposed to work in that parish because he's not born from that parish. Teachers, head teachers, were dehumanized. Mr. Speaker, this approach is a violation of the Constitution. It violates the Local Government Act, the Public Service Standing Orders, and the principles of natural justice. Unless this country has become lawless, unless a country that I know is a constitutional country has become a jungle, the results of this kind of character creates fear and demoralization of public servants who are already understaffed, they are underpaid.
Honorable, I'm just waiting for your prayers. Because, yeah. Yeah, prayers, Honorable.
I want to ask this House to censure the method that the Honorable Minister used and uses on work. I also want this House to direct the Minister to immediately desist and hand over all of the cases to the relevant authorities. Direct the Committee on Local Government to give us a report on the activities of this particular minister. Right, Honorable Speaker, if this is not done, then we live in a country that is lawless. I beg to see it.
Thank you. Now, Honorable Dr. Wakida, do you agree with the principle?
I agree with the principle.
The practice is the...
Yes, I agree with the principle, but I don't agree with the methodology.
Thank you.
Thank you.
Honorable Minister for Local Government.
It's really unfortunate if that is true what he has said, that is what the Honorable Justin did. I wasn't there. She was in Budaka with the IGG. So I don't know what transpired. We normally hand over to the people to manage the arrest, because me, I'm not an arresting officer, but I can ask them, what do you think? Don't you think this is your case to manage? But it depends. Was a doctor found with money? Was a doctor found getting a bribe? If there was no bribe and it was a hearsay, I can't allege that the man is corrupt or should be humiliated. We are really sorry to the doctor and the people of Budaka for such incidences. However, in some places where you have seen those arrests conducted, those are confirmed cases. In Maracha, where a health center fund of one sub-county where the member of parliament comes from was, a health center wasn't put, but the health center was upgraded to health center 3 status with 1 shed, without a toilet, without a store where to keep the drugs, with just 1 bed for inpatient, and they put a signpost, health center 3, but 650 million was released by the Minister of Health to be spent. So when I reached there, I asked DHO, who was in charge of this procurement. He said, that is DHO. So he said, now you DHO, I think now you need to be managed. And he was taken. So I mean, that one, do we need further investigation? So they said, you take and manage. Then, in some scenario, you find workers like a road contractor, fully just telling you this is a pit latrine, when the pit latrine has no hole, it has no pit. So such a person, you want him to be given flowers. That person doesn't deserve flowers, but he deserves to be managed by those people. So the anger amongst Ugandans, actually Ugandans in his place, in the honorable...
Information.
Okay.
Information. Honorable Marshal, you don't access a microphone without...
Now, Right Honorable Speaker, in Honorable Marshal's place, we gave them 900 million to make 1 kilometer of road in Panyamul. So last week, the president said I should go to Papakwach. When I reached there, I went to Panyamul. I found the road, they had only done 10 meters, and on account, the man said, money, 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 money. I asked how much? We have 12 million. Town clerk, where is the money? Say, Honorable, we have 12 million. Where the material? Material is there, but there is no material. So should such a man be given flowers? So that one is also managed. So I know Honorable Mwiru, being a good lawyer, he will say this is wrong. But Honorable Mwiru, wait when it comes to your constituency. When they eat a city school, that is how you'll appreciate that some people need not to be handled with patience and politeness. They annoy. That sends a message to all the corrupt. Don't do corruption, but we shall do things within the law. We shall do things within the law, and it is proper to give someone a fair hearing and a fair handover. I don't touch, I don't hold, I don't have a sale in my car, neither does she. But I will talk to Honorable Namere to make an apology to Honorable Wakida and his subjects and the people of Budaka. They deserve proper apology.
Now, Honorable colleagues, so when the member submitted this matter, I passed it on to the concerned minister, Honorable Namere, and I even gave her a call. She was supposed to come, but I think she must have been held up, because usually I don't want ministers to be ambushed, especially on such matters. So yes, so I hope. The only thing she told me, I remember, was Honorable Wakida is not from Budaka. Okay? And number 2, no, that's what I was told. Number 2, she went there on assignment to go and handle that matter. So that's what she told me. But I hope we will get time. But so my proposal would be, maybe you update this house on what you've done. Even you never know on the methods